Welcome to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media.
Hello and welcome to the Soul Pit Media Health and Business Report. Today our special guest is Dr. Sylvia Owusu-Ansah, board certified pediatrician and pediatric emergency physician with UPMC. Dr. Owusu-Ansah, welcome to the Soul Pit Media Health and Business Report.
Well, thank you. Thanks for having me.
Now, Dr. Owusu-Ansah, growing up, did you always envision yourself as being a physician?
Yes, so since the young, tender age of 7, I've wanted to be a physician. I actually drew a picture of a rectangle with a cross on it signifying a hospital and myself in a white coat. So since the young age of 7, I pretty much knew the doctor is what I wanted to become, which I know is not common for a lot of people. I wanted to be a lot of other things too, but including a dancer, but the doctor part just stuck with me.
Wow, that's very interesting. Now, doctor, in your journey to become a physician, I understand that your stepfather played a strategic role. Can you talk to our listeners on how he influenced your journey?
Yeah, so my ancestry is from Ghana, West Africa, particularly the Ashanti tribe. My parents, my mother and my biological father were from Ghana, as well as my stepfather were immigrants from Ghana. And so in being immigrants, they valued education. For us growing up, it wasn't an option to become educated or to get higher education. That wasn't an option for us. And so in growing up, we were witness to that. And one of those testaments was my stepfather, who had a PhD in communication, had a master's in public health, and worked for the World Health Organization as an HIV/AIDS educator at the peak of the worldwide pandemic in the early 90s. And he had this unique opportunity to go to the newly established democratic nation of Namibia, which was formerly a protectorate of South Africa. Now, Namibia lies between Angola and South Africa. Many people did not know about Namibia until celebrities such as Angelina Jolie and Brad Pitt went there. But it used to be a protectorate of South Africa. And as many from my generation can remember, in the early 90s, South Africa and Southern Africa were a hot spot for HIV and AIDS. And so he was helped to educate throughout the country and was aide to the health minister of the newly formed country on HIV and AIDS education and implementation of programs to mitigate the progression of the disease in that region.
Wow, it sounds like that medicine or just helping people is sort of like the family business with you.
For sure. My younger brother is an internist. My stepsister is also an internist. So there are many of them. My mom was a nurse's assistant at Mass General Hospital for over 30 years in the pediatric department.
Yeah, I would call that the family business, doctor, definitely. Now, doctor, how does having a degree in public health, as well as you being a pediatrician, help to serve your patients better?
Yeah, so, there's a few ways of looking at it. One is I'm an emergency medicine doctor, and the beauty of emergency medicine, but also in some ways the downfall of emergency medicine, is we are the gateway to healthcare, right? So we are the ones who don't turn away anybody. We don't have a choice. We see everybody. It doesn't matter what your socioeconomic status is, doesn't matter your race, your ethnicity, your gender, none of that matters. If you are sick, we see you, which is very different from other specialties. And what is nice about the combination of the clinical work of emergency medicine, where you truly take care of the entire community. In public health, I focused on health policy, so creating the policies and the protocols that hopefully translate into better healthcare outcomes. And what emergency medicine allows you to do is to see whether those policies at that level truly translate into better outcomes by how it affects your patients when they come through the door. So public health, the beauty of public health is that it gives you the opportunity to take care of millions at a time. And then to work as a clinician physician, it gives you the opportunity to build those one-on-one relationships and cure people one person at a time. But The public health aspect of health is, the 10,000-foot view of everything that is happening. And the beauty with that 10,000-foot view is that you can take care of a larger population of people. For instance, hand hygiene is probably one of the best examples of public health. Pushing health hygiene has, helped to secure and save many lives and keep many people healthy that otherwise wouldn't have been, simply by removing the germs from your hands so it doesn't somehow get into your body, which, over a century ago seemed like a preposterous idea, right? But public health brings some of that the awareness of simple things that you can do to benefit your health tremendously, and not just for yourself, but for the populations that surround.
Very interesting. I never looked at it that way until you said it, and the way that you presented it made it seem so simple, yet so intricate that both sides kind of work together.
Yeah, I mean, they do. And that's the beauty of what I do, is because I'm able to visualize, and COVID was the perfect example of that. I'm able to see whether those policies that they're making in the buildings and in the rooms translate to patient care, and I'm in the rooms. The beauty is I'm able to be in the rooms to make that policy, but I'm also the boots on the ground to see whether those policies work, or vice versa. I'm able to be that voice at the table to say, hey, this won't work. And these are the reasons why, so I think that the two go hand in hand.
Now, Dr. Ansah, earlier you stated that you were an emergency room physician, but what you did not state that in your current position, you are the first Black EMS medical director for UPMC Children's Hospital of Pittsburgh. Can you talk to our listeners about what that job entails?
Yes, so I'm the EMS medical director at UPMC Children's Hospital of Pittsburgh. I will say I'm not the first. Actually, Dr. Sue Fuchs, who's now in Chicago, was the first EMS medical director of UPMC Children's Hospital of Pittsburgh. But I am the first EMS medical director of color. And so what that means is, EMS is emergency medical services. Most people think of EMS simplistically as just 911, just calling 911. You have folks come to the house in a truck and they take you to the hospital. In the most simplistic view, I think as a pediatrician, that's how kids see, they call the ambulance drivers. All they know is when you call 911, there's this truck that shows up, takes you to the hospital. But EMS is much more than that. EMS is a system, a collection of systems, of which 911 dispatch is a very small part. Emergency medical services includes the personnel that serve, so the EMTs and the paramedics. Those are the EMS clinicians that actually provide care as you are going to the hospital, which again is a nuanced phenomenon, or a nuanced way of thinking about healthcare. If you think about it, just less than 50 years ago, folks were thrown into the back of a paddy wagon and taken to the hospital. Nobody touched them until they got to the hospital, so a doctor could assess them. And you can imagine the outcomes if you're having a heart attack or a stroke. As we recognize now, time is of essence, were abysmal. We were fortunate enough in the city of Pittsburgh to have what was called Freedom House Ambulance, which was the first ever systematic EMS company and EMS group that had an astute bunch of paramedics who happened to be 25 Black men from the Hill District taking care of their Black community. And so because of them, we have part of that system. In addition to the 911 dispatch and EMS clinicians, which were started again by the Freedom House Ambulance folks, the 25 Black men and later women in the Hill District of Pittsburgh, you also have public health in that. So many agencies and systems can provide vaccinations and talk about, preventative things, safety. Within that EMS system is transport and how you best transport a patient, whether you're transporting a patient from home to the hospital or from hospital to hospital, and the type of transport, whether you go via air in a helicopter or you go via ground. Those are all intricate parts of the EMS system that involve people, that involve systems, that involve healthcare.
We'll be right back with the Soul Pit Media Health and Business Report.
It doesn't matter the time nor the place, the conditions or transitions. Doesn't matter who you are or who you're with. Before, now, and always. Through all phases of life. Duquesne Light Company is here for you.
It's a fact. Black Americans are disproportionately impacted by health disparities in our communities. From building better relationships between doctors and patients to breaking down barriers that affect one's health, UPMC is dedicated to healthcare equality for all. With better access to care, preventive screenings, and mental health treatment, we are working to promote the health and well-being of everyone in the communities we serve. Learn more at upmc.com/health disparities.
Port Authority has a new name, Pittsburgh Regional Transit, PRT for short. It's all about doing an even better job of getting people where they want to go every day. It's also about getting people where they want to go in their careers. PRT is looking for some new faces. We're hiring for every position. We offer great pay and benefits and a direct route to a great future. Go to rideprt.org/careers. PRT is an equal opportunity employer.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
Yeah, who's this?
Don Stogie, it's me, Nick the Nub.
Nicky, my boy, what you got for me?
Boss, I got the bundle on some bad news about your best customer, Sammy Sticks.
What, sleeping with the fishes?
Nah, he's still with Wanda, but he's been herfing with the Cigar Fathers.
The Godfathers?
No, boss, Cigar Fathers, you know. Friendly, knowledgeable staff, live outdoor patio jams, and a wide selection of cigars and cigar accessories.
Oh, how do you know so much about this place?
Well, boss, because I've been coming back all week.
What?
Hey, I'm sorry, Don Stogie, but with everything Cigar Fathers is offering, I couldn't refuse.
It's a fact. Black Americans are disproportionately impacted by health disparities in our communities. From building better relationships between doctors and patients to breaking down barriers that affect one's health, UPMC is dedicated to healthcare equality for all. With better access to care, preventive screenings, and mental health treatment, we are working to promote the health and well-being of everyone in the communities we serve. Learn more at upmc.com/health disparities.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. PortAuthority.org.
Do you like entertainment that provides diverse programming? Well, there's a new radio station that provides exactly that. Yes, Pittsburgh's diverse sports and entertainment network provides a mixed radio format and is the place for soulful music, sports talk, and lifestyle programming. Check us out at pghdsen.com. You'll be able to find our radio schedule with all of our exciting entertainment programs. Listen now by going to pghdsen.com.
Did you know that STD rates have increased in Allegheny County?
No, I did not.
Yeah, especially for people under 30.
Maybe I should go get tested.
In Allegheny County, symptomatic syphilis cases increased by 97% and gonorrhea cases by 18% in the past year. And having multiple STDs increases your chances of getting HIV.
Oh, wow. Do you know where I can go get tested?
The Public Health Clinic offers free walk-in STD and HIV screening located at 1908 Wiley Avenue, Pittsburgh, PA 15219.
And it looks like I know what I'm doing tomorrow, getting tested, and I'll make sure to spread the word.
For more information, call 412-578-8081 or visit AlleghenyCounty.us/HIV.
We're back with the Soul Pit Media, Health, and Business Report. Now, Doctor, each and every podcast, I try to learn something from our guests. It's simply amazing to me that years ago when an ambulance came, that no one did anything for the patient but transport them to the hospital. It's amazing how far we've come.
Yes, and this is the last day of National Minority Health Month. April is National Minority Health Month, and we need to recognize where we came from and recognize that off of the backs of these 25 Black men in the Hill District of Pittsburgh, in addition to Dr. Peter Saffer, who is a revolutionary person of his own, an immigrant from Austria who is known as the father of CPR, as we know it, he perfected CPR, and Dr. Nancy Caroline, who was a female pioneer in healthcare who produced the first ever EMS book for EMS clinicians to learn from and help to lead the Freedom House ambulance clinicians to take the best care of their own community, all started in Pittsburgh. And we remind ourselves of that every day, and we are working to hopefully provide these, pioneers Congressional Gold Medal as well. And so we have to remember the shoulders that we stand on. So I couldn't be here talking about the EMS position that I have today without the Freedom House ambulance folks. And so, they were very forward thinking about providing health care. They gave Narcan before, Narcan was the thing. We think Narcan is new in the way of opioid use disorder and addiction, but they were using that. They were placing IVs in patients in the back of an ambulance. They were doing EKGs in the back of an ambulance. They were, providing breaths in the back of an ambulance and CPR at home, in homes. So very grateful to them for that.
Well, you know what, Dr. Owusu, I will go one step further. I will make a commitment to do some research and try to find someone who actually took part in the Freedom House movement and dedicate a special show just for that, because that's something that needs to really get out there. And I give you my pledge that Soul Pitt will do that.
So I appreciate that so much. And I'll put out there May 15th, the National Association of EMS state officials will be hosting a luncheon to honor. There is at least 8 to 9 living Freedom House members, including Chief John Moon, and they will be honored. And, after this, I can send you the link for that luncheon. Chief John Moon has been very vocal and would be a great spokesperson for Soul Pitt, as well as I would encourage everybody to read the book by Kevin Hazard called American Sirens. It distinctly tells the story of all the major players in EMS, including Freedom House, Dr. Peter Saffer, Phil Halen, and Dr. Nancy Caroline. So American Sirens by Mr. Hazard is a great read.
Well, Doctor, I have to thank you for educating me, not just my audience, but educating me to see. I didn't grow up in Pittsburgh, but Pittsburgh has a rich history in the Black community of leaders and trendsetters. So I will do my research, and as I stated, it will be an honor to do something to educate our listenership about the great exploits that these pioneers made the way for people like yourself.
Yes, and I appreciate that so much.
Oh, definitely. Now, Doctor, we like to try to end each show on a very positive note. And taking that into consideration, Doctor, what advice can you give our younger listeners who may want to become the next Dr. Owusu?
I would first encourage them to be the next doctor, whoever they are, because I believe that everybody that is placed on this earth has the potential to be their greatest self. Whether they choose to be that or not, that's a different story. I would also encourage folks to listen to your internal compass. If you're faithful, I have a strong belief in Jesus Christ, and so that has guided me. That has been my compass and my guidance. And I say that to say, even when there have been naysayers out there to say that I couldn't do it, or I wasn't the right person for the job, and I felt in my internal compass and in my faith compass that was otherwise, I was able to move ahead. So it sounds very cliche, but I would encourage the youth to believe in themselves, and to believe, if they have a faith, to believe in that, and that there's somebody looking out for you to move you to where you want to go. And I am so grateful for the shoulders that I stand on as well. Mentors are so important and so key in our lives, and support systems. the support system in the way of family. Maybe it's grandma, maybe it's an uncle. Support, those teachers that have grounded you and shaped you. Keeping in connection with them and building your own community and, supporting others within that community is what I would encourage people to do. But, in the cases where you feel that no doesn't fit, listen to that. There are some situations where, a no is out of love and is to help guide and direct you, and it's probably the right advice. But there are some no's that, where people are just trying to block the path. And I think that everybody can reach their highest potential. Everybody has the potential to reach their highest potential if they so choose, no matter what obstacles they come from, because we hear those stories every day.
Well, that is great advice. And Doctor, I want to thank you so much for taking time out of your busy schedule to be with us today. And you have me excited about learning more about Freedom House and the whole movement and how that brought healthcare to our community, especially when if we wouldn't have did it, there wouldn't have been any in a lot of cases in our community. So you got me excited about that. And also just knowing that there is someone like you in healthcare that looks like me is a greater bridge. Yeah, it is a greater bridge for us as a community to do better with our healthcare.
Yes, and we need to learn how to look out for each other. One of the things that I'm doing right now that is gaining traction is CPR education. And what's really sad to me is that, people of color are less likely to receive CPR, whether in a white neighborhood or a Black neighborhood. So when I go into communities and teach them, I say, nobody's going to take care of us but us. So there's certain things we need to learn how to do to take care of us because nobody else is going to. And so that's why we do what we do.
Well, like I stated earlier, Soul Pit Media is a willing partner, to help you to get the word out there and also to make sure that we have a safer, healthier community. There's an old saying, to whom much is given, much is required, and Soul Pit Media will gladly shoulder what we need to shoulder to make sure that our community is healthier and thrives.
I appreciate that so much, and I appreciate the opportunity to speak about my experiences and Freedom House. And so thank you all very much for taking this time.
Doctor, you are quite welcome, and the best to you in your chosen field. But Pittsburgh is better by having you here.
Thank you, sir. You as well. Thanks for telling the story.
We'll be right back with the Soul Pit Media Health and Business Report.
It doesn't matter the time nor the place, the conditions or transitions. Doesn't matter who you are or who you're with. Before, now, and always. Through all phases of life. Duquesne Light Company is here for you.
It's a fact. Black Americans are disproportionately impacted by health disparities in our communities. From building better relationships between doctors and patients to breaking down barriers that affect one's health, UPMC is dedicated to healthcare equality for all. With better access to care, preventive screenings, and mental health treatment, we are working to promote the health and well-being of everyone in the communities we serve. Learn more at upmc.com/health disparities.
Port Authority has a new name, Pittsburgh Regional Transit, PRT for short. It's all about doing an even better job of getting people where they want to go every day. It's also about getting people where they want to go in their careers. PRT is looking for some new faces. We're hiring for every position. We offer great pay and benefits and a direct route to a great future. Go to rideprt.org/careers. PRT is an equal opportunity employer.
Looking for a cost-effective way to help increase your company's bottom line? Look no further than Soul Pit Media. With our award-winning print, internet, podcast, and Soul Pit television options, we can help your business get to that next level. For more information, contact Craig Dawson at 412-407-7685. That's 412-407-7685. And let Soul Pit Media take you to that next level.
Yeah, who's this?
Don Stogie, it's me, Nick the Nub.
Hey, my boy, what you got for me?
Boss, I got the bundle on some bad news about your best customer, Sammy Sticks.
What, sleeping with the fishes?
Nah, he's still with Wanda, but he's been herfing with the Cigar Fathers.
The Godfathers?
No, boss. Cigar Fathers, you know. Friendly, knowledgeable staff, live outdoor patio jams, and a wide selection of cigars and cigar accessories.
Oh, how do you know so much about this place?
Well, boss, because I've been coming back all week.
What?
Hey, I'm sorry, Don Stogie, but with everything Cigar Fathers is offering, I couldn't refuse.
It's a fact. Black Americans are disproportionately impacted by health disparities in our communities. From building better relationships between doctors and patients to breaking down barriers that affect one's health, UPMC is dedicated to healthcare equality for all. With better access to care, preventive screenings, and mental health treatment, we are working to promote the health and well-being of everyone in the communities we serve. Learn more at upmc.com/health disparities.
The future of transit is now, and we are working to improve your ride. Look for bus tracking technologies and other innovations to keep you better informed. Getting around town has never been so easy. PortAuthority.org.
Do you like entertainment that provides diverse programming? Well, there's a new radio station that provides exactly that. Yes, Pittsburgh's diverse sports and entertainment network provides a mixed radio format and is the place for soulful music, sports talk, and lifestyle programming. Check us out at pghdsen.com. You'll be able to find our radio schedule with all of our exciting entertainment programs. Listen now by going to pghdsen.com.
Did you know that STD rates have increased in Allegheny County?
No, I did not.
Yeah, especially for people under 30.
Maybe I should go get tested.
In Allegheny County, symptomatic syphilis cases increased by 97% and gonorrhea cases by 18% in the past year. And having multiple STDs increases your chances of getting HIV.
Oh, wow. Do you know where I can go get tested?
The Public Health Clinic offers free walk-in STD and HIV screening located at 1908 Wiley Avenue, Pittsburgh, PA 15219.
It looks like I know what I'm doing tomorrow, getting tested, and I'll make sure to spread the word.
For more information, call 412-578-8081 or visit AlleghenyCounty.us/HIV.
We're back with the Soul Pit Media, Health, and Business Report.
Hi, this is Debbie Norrell, and welcome to the Soul Pit Media Health and Business Report Community Calendar. 8th and 9th graders, did you know the high school you choose can make a big difference in your future, in college, in career, and in life? There are only a few seats left in the 9th grade fall class for City Charter High School. Schedule a tour while classes are still in session and see for yourself their innovative approach to education. Apply now at cityhigh.org/admissions. Registration is open for the Black Birth Expo. This is a free event filled with resources, informational sessions, vendors, special guests, and more. Update to VIP for just $25. Mark your calendar right now for June 1st at ACH Clear Pathways Kauffman Center, 12 p.m. to 6 p.m. For more information on how to register, go to https:/bit.ly/registration BBE24. The 61st Need Annual Scholarship Awards Dinner will be held on Friday, May 3rd at the Wyndham Grand Downtown Hotel. For more information, visit needpgh@gmail.com. It's not too early to make your plans for the Cincinnati Music Festival, July 25th, 26th, and 27th. This year's lineup includes KRS-One, Neo, Fantasia, New Edition, and more. It all takes place at Paycor Stadium. Go to soulpit.com for more information. Did you know most sexually transmitted diseases have no symptoms? Did you know untreated sexually transmitted infections can cause fertility issues in all genders? Did you know having multiple STIs increases your chances of getting HIV? The only way to know your status is to get tested. The Public Health Clinic offers free and confidential walk-in HIV STI screening. For more information, call 412-578-8081 or visit www.alleghanycounty.us/PHCLINIC. Pittsburgh Regional Transit's new Ready to Ride mobile ticketing app offers a convenient way to purchase transit passes and access other important information so that you can be ready to ride. Scan the QR code or call 412-442-2000 for more information. Don't forget to visit thesoulpit.com for the latest in theater, musical entertainment, job opportunities, and health information. That's thesoulpit.com. Thank you for listening to the Soul Pit Media Health and Business Report, brought to you by Pittsburgh Regional Transit. Looking for a great job with benefits? Check out their website, rideprt.org/careers. Thank you for tuning in to the Soul Pit Media Health and Business Report, hosted by Craig Dawson, Vice President, Soul Pit Media. Thank you, Pittsburgh, for your continued support.